having an amazing day wherever you are. Um, Today I wanted to, reflect and share with you a story that about a conversation that I had with someone yesterday. He is a business associate that I know, and I had met at an event last night. And he was talking to me about his wife. His wife is a nurse, and it was really interesting to hear about her experience, which I can totally relate to, and was, a similar kind of a... Hi, Hannah. But from an outside perspective, to really talk about how her business demands, her work demands, affected him. And so she had worked many years in theatre, and so they were 10-hour working days. And he said to me, when she come home, she was spent. There was nothing else left in the tank. She would walk in the door. She had nothing left to give him. And he said she was hangry, like she was moody, hungry, and that was it. She had absolutely nothing left. She had given everything to her patients, to her colleagues, to her job. And that's something that really resonated with me. That's something that I could relate to in my own nursing experience, and supporting nurses is something that I'm really passionate about. He then went on to say that she now works in day surgery a few days a week, and then works in a laser clinic for the other couple of days. And the changes that he had noticed in her through the different hours, no more shift work, no more night shift, and I guess the changes that he'd noticed in her. But he also commented about the give mentality that is in the healthcare industry and is in other industries as well, and something that I find most commonly in the women that I speak with. And in my personal experience, it was something I spoke with a friend today about, and that it was very much in our studies, degree, that giving mentality, that you gave so much. If you just go in and do the tasks, you're going to be an alright nurse, but your patients aren't going to get the full care, the full experience, and we give so much. And it caused me to reflect on, so as healthcare professionals, we help and support and nurture the health of other people at the cost of our own health, which really, it amazes me. And it really just confirms, I guess, the importance of really looking after yourself so that you can look after others. And in my own experience, and in many people that I've spoken with, the first thing to go when you're stressed, when you're time poor, when you're tired, is your self-care. It is the first thing to go. And when I say self-care, I don't mean a bottle of wine with your girlfriends. That has a purpose every now and again, but that is not self-care. That is self-sabotage, and that is stopping feeling the emotions and things that you need to feel. As I say, not dissing it, it has a role sometimes, trust me, but it is not self-care. Self-care is that cup of tea, reading a book, you time. Self-care is taking a walk on the beach, connecting with nature, something that is going to make you feel great. Self-care is meditation. It's whatever it is to make you feel really good. And something that goes first when we're time poor and stressed and tired is our diet. The more reliance on the processed food, on the things that aren't truly nourishing us. Giving to ourselves includes what we put in our bodies as well, what we put in our temples. We only get one. So the conversation last night and today with my friend, it's really sort of got me reflecting of how I can best support my ex-colleagues, any clients that I'm working with who are experiencing exhaustion, burnout. And I'd ask you to have a little bit of a think about what you do to manage your stress, to manage what do you do for your self-care, and do you make it a priority? I invite you to put some comments down below as well. If you want any extra tips, or if this is something that you are struggling with, send me a message. I'd love to have a talk about how we can better support you, because it isn't until you truly give yourself and give to others. Doing a disservice to yourself does no one any good. You are your most important priority, and that is not from a selfish way. There is nothing selfish about caring for yourself. Friends, I'd ask to I guess reflect on what's your experience been of looking after other people's health at the cost of your own. The shift work, the skipping breaks, the only having 8 hours between shift. Well, we can't get 8 hours sleep if we're only having 8 hours in between shifts. That kind of thing that is so prevalent in many industries. What are you going to do to make you a priority? I hope everyone is having a wonderful, wonderful day. And hi, Hannah. Thanks for watching. Pop some comments below. I'd love to connect and see how we can better look after you. Bye.